Am I audible now? Yes. Am I audible now, everyone? Okay, that's great. So hello everyone, happy afternoon or very good afternoon. I hope and I believe all of you are doing well. And this is a very interesting session because we don't just have the discussion of very important top 10 mnemonics in pharmacology, like the questions, the drugs which are asked very frequently. But apart from that, this is a surprise session where basically 3 students are going to get 3 lucky winners are going to get Amazon vouchers. So it's so stay there till the end, and I'll tell you how you're gonna get the Amazon vouchers, and that will come in the middle of the session. So I'll tell you about that. So stay tuned, and we'll be discussing the top 10 mnemonics pharmacology. I hope that all of you have enrolled for the MedMinds Ultra Combat tomorrow at 12 p.m. It's a free test. With a lot of rewards, you have a chance to win iPad, laptop, Samsung phone, Apple Watch, and significant scholarships or even free Unacademy Plus subscriptions. What you need to do is just invest 1 hour of your time tomorrow, 12 to 1. Remember, it's a live only ranking that will be considered for the scholarships and the prizes. And you can give it either on Android or on the web. So if you're using iOS, maybe you can use Safari, the browser, or you can use Android or the laptop desktop. Okay. While enrolling, you can use the code Dr. Nikita. Anybody who has not enrolled yet, you can see that pinned link in the live chat, the blue color. It's the Unacademy Combat. If you click on that, you'll be able to see the link. Please enroll for that without any fail. And you can use the code Dr. Nikita while enrolling. Okay. So, as I said, I'll tell you about the surprise, the 3 lucky winners today. How we are going to decide that, it's gonna come in the middle. So stay tuned till then. Apart from that, yes, it works in laptop as well, the web. Apart from that, we have the NEET PG 2023 All Educator Ultimate Revision Batch, which will include test and discussion, the previous year questions, image-based questions that has started recently on October 14th. So this is going to give you a complete, like, you know, the best educators for the respective subjects. You can see you have the best of the educators, and you'll be able to basically crack the exam with all the important topics that will be discussed. For myself, I would like to particularly highlight this course that I'm starting on 21st of October. It's a crash course on pharmacology, right? As I've always mentioned, pharmacology has been one of my favorite subjects, and I absolutely love working on the mnemonics and making pharmacology easy. So I'm starting this on 21st October. This is only for the Plus or Iconic subscribers. It's gonna be 10 sessions, 1.5 hours each, entire pharmacology. Topic wise will be discussed, everything which is relevant for the exam. So if you're an INICET candidate, you can leave pharmacology for this course. We are doing it before INICET. FMGE students definitely should attend that, and also the NEET PG students. All the exam, entire pharmac will be discussed. And we are coming close to the high yield mnemonics of all subjects. We have the last session on October 17th at 5 p.m. Right, today we discussed PSM. Okay, so my students who were there in the Plus class, did you try solving the test of significance PSM questions? The topic that we discussed in the today's mnemonic class, that how do you decide, easy trick to remember the chi-square test, the t-test, ANOVA test. All right, Ramesh, so were you able, I hope you were able to solve the questions. And apart from that, we are coming up with this radiology revision course for FMGE on November 3, and the test and discussion for NEET PG students on December 15th. Okay, on December 15th. So we have radiology dedicated courses also. Apart from that, the cheat codes, the mnemonics, the tricks in other subjects as well that I would be taking. Okay, great. QBank 2.0, all the subscribers, make the best use of it. You'll get a glimpse of the QBank 2.0 questions in the combat today. I have seen the radiology questions, and let me tell you, the questions are very good, and the explanations are even better. They help you basically understand the topic. So there's been a lot of revamp that has been done in the question bank and even in the solutions. So the combat will give you a glimpse into that. And also let me tell you that the combat has video solutions to all all the questions. So I've seen the radiology questions because I've recorded the video solutions for those. So at least come back to watch the video solutions. So the questions in radiology, I have explained them with Aju Baju ke, the tricks, the entire 4 options, all of that has been discussed. Okay, what happened to this one? So let's start with the discussion of our mnemonics, and this is the first one here. Anti-influenza drug which acts by inhibiting progeny release is Divya. To access the question bank, you have that practice section in the app. Go to that practice section and you would see subject-wise questions. If you're asking how to access, come back. The link is there, which is pinned. So let us solve at least 2 questions, 2 mnemonics, and then they'll tell you that how you get the chance to win the Amazon voucher for today. Right? So at least after 2 questions, we'll discuss that. Anti-influenza drug which acts by inhibiting progeny release is which of the following? So at least we have ruled out 2 options. I'm glad to see that it's neither lopinavir or maraviroc, because these are not used here in influenza. They are used in HIV, right? The anti-HIV drugs. So these are not the answer. Either it is amantadine or it is zanamivir. So what is the mechanism of action of amantadine and what is the mechanism of action of zanamivir in basically influenza? So zanamivir, the term itself tells you it's used against a virus, influenza virus, and the MI, zanamivir, oseltamivir, all these drugs, basically the MI tells you that it acts on neuraminidase. Okay, it acts on neuraminidase. Yesterday we had discussed in the special class, the KBMD class, neuraminidase is basically the one which is responsible for the release of the virus from the host cell. So basically by inhibiting neuraminidase, it is not allowing the release. So the release is inhibited by zanamivir. Amantadine acts by preventing the uncoating of the virus. Okay, this uncoating which it prevents. So amantadine, remember that amantadine is basically preventing the uncoating. You can remember a naked man. It is not allowing the virus to become naked. So it is basically about making the virus naked. So no man should be naked. So a man is not naked. No man should be naked. So remember, it prevents the virus getting naked. So amantadine is uncoating and zanamivir is basically neuraminidase, the release inhibitor. Now have a look at these drugs, basically antiviral influenza drugs. We have amantadine, rimantadine, oseltamivir, zanamivir and piravimir, basically MI and VI. So these drugs, the oseltamivir, MI and MI, they act by inhibiting neuraminidase which prevents the release. Remember piravimir also. The next question is which of the following drug which acts by blocking neuraminidase is also given as inhalation? Which is also given as inhalation? So remember zanamivir is basically NA, it is given nasal. MI is the neuraminidase and it's an antiviral drug for influenza. So remember, this is also given as inhalation. Okay, this is also given as inhalation. Okay, so that is about this. And amantadine and rimantadine, basically remember, they prevent the uncoating. No man naked, a man not naked. So remember, it prevents the uncoating. Okay, it prevents the uncoating. Yes, amantadine is also used in Parkinson's, and the side effect we have is ankle edema, livedo reticularis. These are the side effects that we see with amantadine. So that was the first question. Everybody is clear? So inhibiting the progeny release is zanamivir, the MI wale drugs, that is neuraminidase, which is responsible for release. The question that we had seen in KBMD, the recent KBMD, was if there's a protection for influenza, even after exposure, people are not getting influenza, it is because of antibody against heme agglutinin. Heme agglutinin is for basically attachment. I hope all of you remember that. Do attend the KBMD sessions on the app as well, which I take. You would get to learn a lot of tricks, mnemonics, and the tricks to solve the MCQs. So look at this diagram. Basically, this is where we have here amantadine. You can see here. I'll zoom this image for you. So amantadine is uncoating, which is prevented by amantadine, and the release is where you have neuraminidase inhibitors. They act on the release. Okay, so the release is inhibited by neuraminidase. And remember the recent drug, which is favipiravir, COVID mein jo aaya tha, favipiravir basically acts by the mRNA synthesis. RNA polymerase is what it inhibits. Okay, it is inhibiting the RNA synthesis. It is RNA synthesis. Okay. So that was about this question. Let's go to the next one. This is the next one. Not given in this acute condition. Okay, which of these is not given in the acute condition which is shown in this image? What condition is shown radiologically and what drug is not used in the acute condition? So very, very important again. So after this question, I'll be telling you the conditions basically to get lucky to win the Amazon vouchers for today. Very good. So see, the trick to be used here is, even if you cannot identify the X-ray, do not think that you have lost on this question and you'll be losing marks. Not given in acute condition, I'm not able to identify what is this image showing. I would look at the options colchicine, steroids, allopurinol, indomethacin. So looking at the options, I get an idea that basically the condition shown is gout. So this is a smart trick basically in MCQ based questions. Even if you're not able to identify the image, basically this is going to be, the options are going to help you. So basically I know from the options that it is gout. And remember that what are we seeing here is, why this is gout is because you are seeing the erosions which has overhanging edges. Overhanging edges, very, very important. The Martel sign or the G sign or the rat bite erosions. Okay? So rat bite erosions, or it is also called as the Martel sign or the G sign. So in gout, we have erosions which have overhanging edges. Okay, the overhanging edges, very, very important. So what do we use in acute gout? The drugs used in acute gout is basically NCC. Remember, NCC is used. NCC is used in acute gout. N for NSAIDs. N for NSAIDs, but we do not use aspirin. Then we have colchicine and we have corticosteroids. These are the drugs which are used in acute gout. So colchicine, corticosteroids, that is C, and indomethacin, which is an NSAID, is used. Allopurinol is not used. Remember, allopurinol rather can aggravate the acute attack. It is used in chronic. To prevent the acute attack, we use in chronic, it is used. Okay. So that is NCC. Remember, allopurinol is not used in acute gout. Okay. Allopurinol is not used in acute gout. Right. Okay. So next question. Before that, let me tell you the so I told you that I'll tell you after the second question on how to get lucky for this today's surprise session to win the chance to win Amazon vouchers, significant Amazon vouchers, right? And how to get lucky is basically all of you who are here have a fair chance to win this. It is just based on your luck. All you need to do is enroll for the link, the combat link, which is given, which is pinned in the live session. I'll give you a minute because we would be having the list of the students who would be enrolling during this session, right? Enroll for the same. There's a pinned link. I'll wait for a minute. You can enroll for the combat by that link. If we are asked for the code, the invite code, use the code Dr. Nikita, and we would revert back with the 3 lucky winners, basically, who would be getting the Amazon vouchers. And this is just the entry, the enrollment for combat is just the entry to win even more prizes tomorrow. See, I want you to give combat, not for me, but it's for you. First of all, as I said, the questions are really, really good. At least I've seen the radiology questions. They are very good. And more so, the explanations also, the video explanations that we have given, they are even better there. So for those who have already enrolled, we can also see your names here. Okay, so remember, it's based on the lucky draw who would be getting the 3 lucky winners to win the Amazon vouchers, right? And for those who have already enrolled, even you would have a chance. And those who have already enrolled, I know that the sincere students who have already enrolled are the ones who would be getting the bigger prizes tomorrow, the iPads, the laptops, and the mobile phones. So please take a minute and do enroll for the same. And give me a quick thumbs up. Open nahi ho raha hai. Let me try and open this at my end. It is getting open to ho raha hai. And when you are going to the enrollment link, remember you have that option. Is it MBBS year 1, MBBS year 2, year 3, year 4? Because remember, this combat is going to be separate for each year students. A first year MBBS student will not be competing with the intern or post intern. It's going to be separate, right? So make sure while enrolling in a hurry, you are not going for any other year, but somewhere where you'd have higher chances to win the prizes. If you think you are very good with the first, you can go with that. ठीक है, चलो, great. Which year combat? Please make sure you give the specific year. You never know if you win the prize. You might be asked for a proof to show whether you are actually in MBBS first year or second year or third year. तो वैसा हो सकता है. So if you don't want to lose, so I would suggest कि if you are intern or post intern, तो उसमें ही जाना. If you are a third year student, go for third year. Okay. You cannot enroll in everything because the combat is only one at 12 to 1 p.m. So you have only one chance to do that. Chalo, let's go with this. That's what I said, Amulya. Don't try to do that. It might act like a double-edged sword. Prize milne ke chance बढ़ जाएंगे, but if you are asked for a proof, you might absolutely lose on that. So don't do that. Okay. Chalo, let's go with the next one and third. I wish we had all these prizes and rewards when we were giving the entrance exams. We would have been millionaires by now. So a 24-year-old woman is diagnosed with cancer. Her oncologist wants to use a chemotherapy agent specific for the M phase of the cell cycle. Which of the following drug meets the criteria? Code nahi pucha, koi baat nahi. If you have already been on the Unacademy app, it might not ask you a code as well. If you are enrolling for the first time, then it will ask you a code. M phase ke liye, the oncologist wants to use a drug. Which will be the drug? Very good. Amazing. Who has got it right the first? I can see the first one to get it right is Dr. Swati. So yes, it is vincristine. Okay, it is vincristine, which is the drug which is M phase specific. Okay. So remember, this is important. What are the anti-cancer drugs acting on the M phase? Which are the anti-cancer drugs acting on the M phase? The mitotic phase. Which are the drugs acting at the M phase? Right. Remember, it is MTV. MTV, right, used to be one of the favorite channels college time में. अभी तो कुछ नहीं देखते हैं. So you have M phase पे we have the texanes and we have the vinca alkaloids. Okay, we have the texanes and the vinca alkaloids. So remember MTV. So vinca alkaloids and the texanes. What includes in texanes? You have paclitaxel, docetaxel. Now, what is the difference in the mechanism of action of two is vinca is IN, paclitaxel is P. So basically vinca inhibits, okay, vinca inhibits the polymerization. It inhibits the polymerization of microtubule. Paclitaxel promotes. So basically what happens is paclitaxel promotes the polymerization. What paclitaxel blocks is the disassembly, the step which is required to go to the next phase of the cell's division, that is prevented. So paclitaxel promotes the polymerization, but after the polymerization, the next step, which is the disassembly of the spindle, that it does not allow. So remember, vinca alkaloids, that is vincristine, vinblastine, they inhibit the polymerization. Okay, so they don't allow the polymerization itself. So this is also important to be known. And remember, it's vincristine. Okay, it is vincristine, which is M phase specific. All of this will be discussed in detail in the pharmacology crash course as well. I'm starting on 21st. So, बाकी जो भी है उसका side effect क्या है, what are the other important points to be known, all of them will be decreased. So the next one, all of the following act on GP2B3A except which of the following? All of the following act on GP2B3A except? Everybody should get this right. And who has got it right the first? Many students have got it right. Anjali has got it right the first, I can see. Then we have Rasi, Doc, Charu. Remember, it is A. It is not C. It is tranexamic acid. It is Tranexa, which is basically used in menorrhagia वगैरह. तो Tranexa है. GP2B3A. It is 2B3A. Remember the B and the A. Okay, the B and the A. If you have the drug name which has BA or AB together, then it is GP2B3A. BA हो या AB हो. जैसे एप्टीफीबटाइड उसमें BA है, एप्सीजीमैब इसमें AB है, टिरोफिबान इसमें BA है. So if it's BA or it's AB, then it is GP2B3A drug. So remember the BA or the AB drugs. And you can also remember BA, AB and the Fib wala drugs, because basically this GP2B3A required for addition or aggregation. It is required for platelet aggregation, right? So fibrinogen platelet aggregator, Fib wale ko fibrinogen ko inhibit karne wala. So eptifibutide, tirofiban, the Fib wale drugs are also the GP2B3A. Okay, the Fib wale drugs are also GP2B3A. Okay, yes. And when there is GP2B3A mutation, the disease that we have is Glanzmann's, right? We have Glanzmann's. So you have Bernard Solier, you have Glanzmann's. Glanzmann's is aggregation defect, GP2B3A. All right. And apsizimab, by the name of the monoclonal antibody, also you know that the CI and the XI, apsizimab. The CI tells you that, what does the CI in the name of monoclonal antibody tell you? What if any drug which has CI, what does that indicate? CI basically means it is used for the circulatory system. It's used for circulation, right? Blood से related है, cardiovascular system blood से related है. XI tells you that it is zymeric or chimeric monoclonal antibody. So basically XI tells you that it is chimeric. So circulation and chimeric, that is what it means, and it's a monoclonal antibody. And AB tells you that this is GP2B3A. Okay, it is GP2B3A. All right. So that was about this question. Let's go to the next one. The next mnemonic. All ACE inhibitors are prodrugs except. All ACE inhibitors are prodrugs except. Dr. VV, right, that's the mnemonic. Who has got it right? No, it's not D, it's not A, it is C. Dr. Swati, again, I can see Dr. V, Dr. Swati. It is captopril, a very, very important, like since ages this question is asked. So all ACE inhibitors are prodrugs except two, captopril and lisinopril. Okay, it is captopril and lisinopril. So remember that captopril and lisinopril are active drugs. They are not prodrugs. You remember it as cap में lice, that is lice is active. So it's basically like if someone has lice in the hair, in the head, even if you wear the cap, so किसी का यहाँ पे head है, उसमें louse है, even if you wear the cap, the lice is still going to be active, right? So under the cap, basically the lice, that is the lisinopril, is active. Okay, it's lisinopril. You cannot hide it with the cap. So remember that it is under the cap, lice is active, that is captopril and lisinopril. Okay, captopril and lisinopril, cap and lice is basically active. Okay, so that's a trick to remember. Now going to next one, beta 1 selective blocker is Which of these is a beta 1 selective blocker? Propranolol, nadolol, labetalol, nebivolol. Very good. Great. So who has got it right? It's not nadolol. It's not nadolol. It is not labetalol. Dr. Erulia, Dr. Vivi. Yes, Himanshi has got it right the first. And so it is nebivolol. Okay, it's nebivolol. The trick to remember this is, particularly in this question, is, see, first the beta 1 selective blockers, that is the cardioselective blockers. So basically, these are the drugs which have their spelling starting from A to M. After N onwards, they are non-selective. Okay, they are non-selective. N से लेके जो है वो सब non-selective है. But exception है कि nebivolol. When I write nebivolol, remember the BI, that is the beta 1. It's a selective beta 1 blocker. When I write nadolol, nadolol is दोनों को block करने वाला, that is beta 1 and beta 2. It is a non-selective blocker. It's a non-selective. So remember, nado is दोनों को, nebi is beta 1. Propranolol, P comes after M, so it's non-selective. Labetalol, even if it comes before M, labetalol comes here. But remember, labetalol is both alpha and beta. So remember, labetalol loves L. It is loves both alpha and beta. So A and B both are inhibited. So labetalol basically comes there. So that's why it's not a beta 1 selective blocker. So the answer here is nebivolol. Otherwise also the trick to remember is NBE का bum. You know, NBE बहुत सारे bum फेंकते रहते हैं. Recent वाला being the change in the MBBS curriculum, right? The duration of the years, the subjects, and all these NBE का bum directly affect the heart. That means they are cardio-selective. So NBE, BAM, you can see that there is no P. These are the beginning letters of the drugs. N is only one, and that N stands for nebivolol. There is no L in NBE ka bum. Okay, so remember that it's only nebivolol, and the rest of the drugs are till M, which are the cardioselective. L is not there, labetalol is not there. Okay, so remember this is beta 1 selective blocker. Next question here, calcium channel blockers belong to which class of antiarrhythmic drugs? Calcium channel blockers belong to which class of antiarrhythmic drug? Is it 1, 2, 3, 4, 5? Absolutely right, it is D, that is class 4. How do you remember? Calcium channel blocker, CA blocker. C is the third alphabet, A is the first alphabet, so it is class 4 antiarrhythmic drug. What do we have in class 1? What do we have in class 2, class 3, class 4 and class 5? 1 is basically, remember, ONNA, that is sodium channel blocker. 2 is the second alphabet B, it's a beta blocker. 3 is with the 3 lines, the standing line, the slanting line. You can see the effect of me teaching Kyra. Standing line, the slanting line, draw standing or slanting. So you have the 3 lines basically which make K. So 1, 2, 3, it is the class 3, and 4 is calcium. That's basically the 3 plus 1. Okay, that is 3 plus 1. So that is calcium channel blocker. So 1 is sodium, 2 is beta, 3 is the potassium, 4 is the calcium, and 5 is the miscellaneous drugs, right? Adenosine, atropine, digoxin, all those are basically miscellaneous, come in group 5. So calcium channel blockers are class 4. Okay, calcium channel blockers are class 4. Okay, that was about this. Let's go to the next one. ये यहाँ पे आ गया स्लाइड, बीटा 1 सिलेक्टिव ब्लॉकर्स. ये बम है जो कार्डियो सिलेक्टिव है, NBE का बम जो कार्डियो सिलेक्टिव है. ठीक है, नेक्स्ट, ट्रू अबाउट रिवारोक्साबान. True about rivaroxaban is, let's see who's getting this right. Anant, are you answering for the next one? Because so many questions have got D as the answer, so I am not understanding it's for the same or the other one. True about rivaroxaban, whether it's a thrombin inhibitor or it's a factor 10 inhibitor, whether it's oral or it is parenteral. Very, very important. So we have discussed this in the recent plus class also medicine jam. We have discussed ECGs and the management for atrial fibrillation, the drugs used for anticoagulation. Why do I see a lot of confusion? I see the major confusion is between B and D. So from the drug name, we know that rivaroxaban is a XA banning drug. It's a factor 10A inhibitor drug. So yes, it's a factor 10A inhibitor. It's not a thrombin inhibitor, right? It's not a thrombin inhibitor. The next question is whether it's parenteral or it is oral. Remember the X-wala drugs that we have, all the factor 10A X-wala drugs are given orally, like Zimelagetran, all the factor 10 inhibitors, Apixaban, Rivaroxaban. The drugs which have X in their spelling, these are given oral. So this comes under the category of this newer oral anticoagulants, the NOAC. So you have the newer oral anticoagulants. One is the factor 10A inhibitor, and which is the other one? Which is the thrombin inhibitor, which is given orally? It is dabigatran, right? It is dabigatran. We'll discuss all of this in the pharmacology crash course on the Plus platform starting 21st October. Okay, so all of this, the tricks will be discussed. So this is factor 10A inhibitor, which is basically oral. Okay, remember the X-wale are given oral. It is factor 10A inhibitor. Okay, very good. Let's go to the next one. Bevacizumab is a monoclonal antibody against. So I see that quite a few students have joined in the session now, late maybe. And if you are here because of the surprise rather than the mnemonics to win the Amazon voucher, the only thing you have to do is enroll in that link which is given, the pinned link for Combat. And we'll be having basically a lucky draw. The students who are enrolling during this live session will be getting a chance to win the Amazon voucher. So this is for students who have joined now, like who've joined late before the, after the announcement has been done. Yes, very good. The answer to this, Bevacizumab is a monoclonal antibody against. Whenever you have a question on monoclonal antibody, try to decode the spelling. MAB is a monoclonal antibody. ZU tells you that which monoclonal antibody is it? Is it chimeric? Is it mousewala? Is it humanized? Or is it human? So remember, ZU is basically humanized. It is humanized. ZU is humanized. It's not human. It is humanized. And CI, then you have another thing here. The CI tells you that again it is used for circulation. Circulation, matlab vascular wala system. So remember, it is VEGF. It's a vascular wala. So remember, it is VEGF. That is how you can solve. TNF alpha, CD20, CD25 basically has something to do with the immunity wala system, the inflammation and the immunity. VEGF is something which has to do with the circulatory system. So it is against VEGF. So basically it prevents the neoangiogenesis used in diabetic retinopathy as well, or the age-related macular degeneration, all of those where you do not want neoangiogenesis, because it basically promotes the vascular growth, the neoangiogenesis, right? TNF alpha का mnemonic सबको पता है, इटली की अदालत में गोल्ड सर्टिफिकेट देके इंसाफ, those are the drugs. CD20, one drug is rituximab, okay, and then we have CD25. Which are the drugs on CD25? Recent INICET AIMS question. Bevacizumab, daclizumab. These are interleukin-2 receptor, basically CD25. Those are the drugs. Yes, ranibizumab is also, it is VEGF. So you can remember this as Bevafarani. Okay, Bevafarani. So it is Bevacizumab and Rani. It is used against VEGF. It's Bevafarani. ठीक है? Next वाला क्या है? ये हो गया और ये हो गया. So basically this we have already discussed. All act on GP2B3A except tranexamic acid. The Fib wale drugs, the AB or the BA drugs, they act basically on GP2B3A. So let's quickly revise this, and the students who are here, please take your chance to win the vouchers. Enroll on the combat, and because if the session gets over, I'm giving you time by revising to enroll during the session. So Progeny release is neuraminidase MI wale drug, which is zanamivir, also given nasally. Next we saw was acute condition gout. NCC is used, that is NSAIDs, colchicine steroid, but aspirin is not used. Allopurinol not used in acute gout. Gout has this rat bite erosions, Martel sign or the G sign, erosions with overhanging edges. M phase pe we have MTV. On the M phase we have the texanes and the Vinca alkaloids. Vinca inhibits the polymerization, paclitaxel promotes the polymerization. So vincristine is on the M phase. GP2B3A is the BA, AB or the Fib wale drugs. So you have eptifibatide, apsizumab, tirofiban. Tranexamic acid is not GP2B3A. ACE inhibitors under the cap, lysis active. So remember, captopril and lisinopril are active ACE inhibitors. Then you have beta-1 selective blocker. Nebivolol is the BI. Okay, nebivolol is the BI, and it is beta-1 selective. Nedolol is dono. Labetalol loves both alpha and beta. Propranolol is after M. Calcium channel blockers is 3+1. That is class 4 antiarrhythmic drugs. Beta-1 selective dekh liya, NB ka bum. Rivaroxaban is factor 10A inhibitor, and all the X wale drugs are given oral. Okay, it's not parenteral. Remember, it is given orally. Okay, it's oral. Bevacizumab circulation, so it's used again VEGF. Bevafarani is VEGF. Okay, Bevafarani is VEGF, and GP2B3A we have seen. So yes, please, I hope all of you have enrolled for the combat. Okay, the winners will be, who are the winners? We'll be sharing the poster across, because once this is over, then we need to see who all have enrolled. Basically, we need to get the list, and then we need to take those, who are the lucky winners. The team would be sharing across the poster, the flyer with the winners, and you have, if you have your, you must have given your contact details as well. The team will reach out to you to let you know if you are the winner. Okay, so stay tuned. You have done your best to get the rewards. Let's see who gets lucky, and get even luckier tomorrow by giving combat. As I said, enroll in the respective year, whichever you are, first year, second, third, fourth. Separate exam, so you will be competing with different year students, right? Specific year students. That increases your chances further of getting the prize, right? A first year is not competing with post intern. 1 hour tomorrow, 12 p.m. to 1 p.m. and hoping to see a lot of you, like, because I'm starting with the pharmacology crash course on 21st and the combat is before that, you'll be getting the plus subscription. So I want each one of you to make the best of this. You might be lucky enough to get the free subscriptions as well. All right. So thank you so much, everyone, and goodbye. Take care. Keep studying, keep revising, and keep winning. And any the further sessions, I'll keep you posted on the Telegram group regarding the special sessions, the KBMD YouTube sessions, the plus classes, everything I'll keep you posted on Telegram.